have recently published together with a group of young oncologists in Italy an editorial in ESMO Open to discuss the challenges that we are currently facing in Italy and right now also in other parts of the world in terms of managing cancer care during the coronavirus disease 2019, so the COVID-19 outbreak. Indeed, this type of infection is of major concern in oncology and has radically changed the way we are taking care of our patient in several ways. First of all, we have to remind that cancer patients usually especially those that are receiving active treatment, are more prone, susceptible to infection, so they are kind of immunocompromised in some sense, and so they may be at higher risk as compared to other patients to develop this type of infection. And this is why I think we need extra attention to this patient population, especially for trying to avoid having them infected, especially if they get to the hospital. So what we actually did in our editorial is to try to give some tips or recommendation on how to modify our clinical practice in this current emergency situation, and we based our tips or recommendation based on the indication of the Italian Association for Medical Oncology, where we have actually two specific different scenarios. We have one scenario of patients that are receiving active treatment, so those patients that are being treated. In this case, the recommendation is to discuss on a case-by-case basis the possibility to have a treatment delay. And this is, of course, based on the type of disease, the setting, advanced, early setting, the expected benefit of the treatment that we discussed and that the patient is receiving, the response to the treatment of the patient. Of course, we try to keep as much as we can the active treatment, but in this emergency situation, not all of them probably can be kept. And so the recommendation is trying, of course, to keep all the treatment in the early setting as much as we can, as well as those treatment in the advanced setting where we expect important benefit. Those treatments that are not really urgent to be given or that are not really benefiting the patient, they probably should be postponed in this type of emergency situation. And talking about patients with advanced disease, in terms of reassessing tumor response during treatment, we are actually delaying the restaging procedure, so the imaging procedure in some sense, especially in those patients for whom there is no urgent need to have them scanned or restaged. And regarding oral treatment, so we have chemotherapy agents, targeted treatment that are given orally. In this case, we are trying to implement a system for which this treatment can be delivered at home to our patient without the need for them to come to the hospital. Maybe having blood drawn close to where they live, so no need again to come to the hospital. So this is actually for patients with active treatment ongoing. But there's also another big group of patients that are coming every day to our clinical practice, so those patients that are in oncological follow-up. In these cases, the recommendation is to try to avoid all the visits, the consultations that are not urgent, meaning that those patients that have no sign of disease recurrence, this type of consultation should be postponed. So what we are doing in this specific scenario is to implement what we call the telemedicine or telehealth, meaning that every day we have a lot of phone calls, email exchange with our patient to discuss blood test, imaging procedure. And for those patients that have no specific side effects with the ongoing treatment, that have no sign or symptoms of disease recurrence, we postpone this visit and we just do this consultation over the phone, postponing them for a few months. And the only patient that actually we allow to come for regular follow-up are those for whom we give active treatment or where we have to change treatment in some sort or that have signs or symptoms of disease recurrence. And then Another important point to be considered in this special situation, emergency situation, is the possibility to reduce also the number of people coming into the hospital. So now we try not to have caregivers coming together with the patient, especially if the patient has no real need or has no need of assistance by the caregiver, so that we reduce the number of people coming into the hospital. And then we have implemented a sort of system to have a triage at the entrance of the cancer center, so that all patients coming in are screened for symptoms that are potentially related to COVID-19, and for suspected cases are not allowed to get into the cancer center, but there's a different path to be followed in other departments of the hospital to try to keep as much safe as possible the space inside the cancer center for all the other patients. And I think a final important note to be considered is to protect also healthcare providers, so to protect ourselves with masks, cleaning our hands very often. This is very important also not to have shortage of masks in the hospital. It's not only important for our safety and to keep on doing our job, but it's also very important for the safety of our patient to avoid transmitting any potential infection to them. So the overall idea is to try to keep as much as we can our cancer care, but doing it in as safe as possible for the patient and for the healthcare providers themselves. And then one final note, it's an issue that is becoming quite important in my center in Genova in the northwest of Italy, which is the regional hub also for treating patients with COVID-19. We have an important infectious disease department in my hospital. So we started to see also several cancer patients that get COVID-19, that are infected by SARS coronavirus 2. So what we are trying to implement is to kind of open a specific place to allow infected patients to keep on receiving their care. Because now what we are facing is that these patients get infected and then they are not allowed to come into the hospital, but they may still need some active treatment, of course, as soon as they get out from the infection. For this specific patient population, I think that we need to implement some specific procedure inside each cancer center to also keep on taking care of them and try to maintain their cancer care as much as we can. Cancer research during COVID-19 is indeed another very important issue, and we discussed that in our editorial in ESMO Open. I would say that the fastest answer is that it's of course this infection is low in cancer research in all sorts of aspects, because now all the energy in the hospital are of course focused on the care of this on the management of this emergency situation. So like in my center, we had directives from the hospital that we should kind of slow down all research activities that are not urgent or that can be delayed or postponed in some sort. So from a practical perspective, what we do is we are not opening new trials in these days. It's not possible. And we are slowing down the accrual of patients in clinical trials in which we need extra energy, extra effort and extra time mostly for all the aspects related to the clinical trial. Of course, we try to maintain as much as we can treatment ongoing, so patients that are enrolled in clinical trials are still getting their treatment on time, their staging on time. But yeah, especially for in terms of new clinical trials, we are actually not opening them right now. I think that the main advice to people that are gonna face maybe in the next weeks this challenge is to get prepared in advance, meaning to try to implement all the measures that I've just described, all these safety measures, as early as possible, just to be prepared on what is going to happen. This is again very important, first for the patient and the safety of the patient, their families, but also the safety of the healthcare providers, because a lot of colleagues unfortunately are getting sick also in my unit. So this means that we are less people to cover the same amount of clinical activity in oncology, because we try to maintain, as mentioned, as much as we can our cancer care. So be prepared and try to be as safe as possible, especially trying to avoid having shortage of masks as happened unfortunately in many centers in my country over the last weeks.